Hi, welcome back to the Injury Prevention Leadership Tabletop Conversations brought to you by the Texas Injury Prevention Leadership Collaborative. Please remember, if you haven't already subscribed to our channel, make sure you do so you are notified every time a new video is published. This week, we explore the value in pursuing doctoral level education for the injury and violence professional. Let's join Dr. Marisa Abbe from Texas Children's Hospital, Dallas, Dr. Cary Cain from the Baylor College of Medicine, and Dr. Courtney Edwards from the Rees Jones Trauma Center with the Parkland Health and Hospital System as they discuss how pursuing their doctorates has impacted their journey as injury and violence prevention professionals.
So hi, Cary and Courtney. We are here today to talk about the value of pursuing our PhDs in the realm of injury and violence prevention. So I just wanted to turn it over to one of you to see if you wanted to talk about how your degree has helped you.
I'll start. So I think I know Courtney as well. Like I started in the injury violence prevention field more as a practitioner, and I started immediately after I got a master's in public health. And I felt like that master's degree was really valuable in helping me really to understand how to look at injuries from a public health perspective. And so, but the further that I got along into the field, I felt like I needed more tools in my toolbox to really understand, especially evaluation and effectiveness. And so, because a lot of the things that we're doing, I work in child maltreatment prevention, a lot of things that we're doing is really building innovation and really having to build the literature and really understanding what works. And so I feel like for me, going back to school, it really helps give me some framework to really frame how to structure what the existing evidence is, and then how to build upon that existing evidence and how to measure it. And so I think for me, that's been the most value. And of course, I have, so my just background, my PhD is in nursing, and so it's a research-based degree. And so now I've moved more into research instead of just in practice. But I'll let somebody else speak.
So I counter Cary. My doctorate is a professional practice doctorate, again, in nursing. And in all honesty, the reason that I got my doctorate was I was frustrated. I was very frustrated being at the quote unquote bedside of injury and violence prevention, taking care of these patients, and realizing that one, the information coming from the research, from academics, to try for me at the bedside or in the community, integrate that and be able to get effects was incredibly far-fetched. Like the practice to research gap was astronomical for injury and violence prevention. And I chose the practice doctorate so I can better inform the conversations that I was finding myself in and the processes that I was finding myself in, so that I can work with the academics, that I can work with the researchers to create interventions, to create focuses and projects that would really help me implement them on the street level, because that's where I found the huge gap was. So having a doctorate really broadened my understanding and appreciation, but it also, on a total superficial note, and this is one of my little soapboxes about academia, people all of a sudden started listening to my opinion a bit more because I had the title doctor, whereas my opinion wasn't any more different than what it had been 3 years ago when I started my program. And so, it really just brought a little more credence and credibility, a little more structure. I guess the academics part of the doctorate degree was more abstract and theoretical, more applicable across kind of all settings and disciplines with that regard. I think it made me think a little differently. So yeah, do I enjoy and happy I went through that process? Absolutely. But I did it for, I would say, probably what many people would not think of in going back to school.
Right. And I think I had the opposite experience. So I got my PhD before I even came into the injury prevention field. And so I worked in a lot of, pediatric settings, doing research, mostly qualitative research. And so when I found injury prevention, it was really exciting because a lot of what's missing from our field is the why and the how. Why do people do what they do? How do parents make these decisions around their child's safety or not? And so that's what really drew me to this area, is because there's a huge gap in our understanding of how people make decisions around risk and injury for themselves and others. And so as a qualitative researcher, that's what I was really excited to do. But I agree with you, Courtney. I feel like having that experience and going through the PhD does give you a really good grounding in the theory across different disciplines. So I'm able to reach out to our partners in like educational psychology and say, well, what are you guys, what are some theories that come from your field that we could apply to what we're working on, and kind of have those partnerships with other people.
I have a question for you guys. I'm just curious as to, like, Marisa, you already coming in, having your PhD, and then like Courtney, for you and me, how we were in the field, and then we both got our doctorates. And so throughout it, have you had a difficult time finding mentorship from other doctoral injury prevention people? How has that been for you?
I think the people that I have found mentorship in are not actually in the field of injury and violence prevention.
Right.
The people that have most impacted me are in other fields, but I think that's one of the nice things. Once you get past a certain point in your academic preparation, it's not so much the details that really matter, it's the overall concepts and thinking outside of the box and thinking differently. And in fact, it's an engineer that is one of my close mentors, who has nothing to do in healthcare, has never even probably walked into a hospital. But just his thinking about problems and processes has really opened up things for me. Marisa?
Yeah, I would say, injury prevention is a multidisciplinary field. And so we get to pull from areas, engineering is a great example, of areas that maybe not touch our field directly, but I don't specifically have a mentor in this field either.
Yeah, and I had the same experience where my main mentorship came from a developmental psychologist. And so I was just wondering, I mean, it is great that we are able to pull from other fields, and these people may have never even worked in injury prevention, but we're able to apply that. So
yeah. And I think a big area that we can contribute, or getting the PhD and having the value of that, is maybe through a more rigorous evaluation of the programs that we are doing, because I know we all find it really frustrating to say, okay, we want to do a drowning prevention program or whatever intervention, and we look to the literature and there's not much out there that we can draw from. And so I think whether you have a master's degree or a PhD, we really need to be creative in thinking at how we can evaluate our programs, not just self-report surveys of our, have you done this in the last week, or, have you put a pull fence, but how are we really going to evaluate some of these interventions?
Thanks for watching, and remember to subscribe.